Hi, so my name is Luke, and I did this on cystic fibrosis. Cystic fibrosis is a genetic disease that is autosomal recessive. It is a mutation to the CF gene, which makes the CFTR protein. Um, the mutation to the to this gene will actually removes a single amino acid from the protein's genetic makeup, and that makes it fold not correctly, and it's not the correct shape, and the cell can actually detect this and will dispose of it, not letting it do its job the correct way. There's over 1,700 known mutations that can cause cystic fibrosis. The most common mutation is the F508 del, and about one in every 40 people carry this mutation, and they are carriers. Um, so the figure to your right basically just shows you like um, the chances of someone having cystic fibrosis or being a carrier. The one all the way on the right is rare. Um, they have a good chance of having a child with cystic fibrosis and or being a carrier. Um, Males are typically um, more susceptible to be or to have this mutation and to have cystic fibrosis than females are. So the CFTR protein is the cystic fibrosis transmembrane conductance regulator protein. It basically regulates the flow of the salts and fluids in and out of the cells. Uh, Mainly, it regulates the flow of chloride ions. So these cells are typically found in the lungs and the pancreas. So when they're mutated, they're not able to move chloride out of the cell, which water won't leave the cell either if chloride doesn't, since water is attracted to chloride. So, so if the chloride does not leave the cell, water won't, and that means that it will make a thick and sticky mucus, which will get trapped in their airways, making it hard for them to breathe sometimes, which is basically what cystic fibrosis is. Um, So diagnosing cystic fibrosis mostly happens by the age of 2, but can be diagnosed later on in life. So the first things that they will do is newborn screening, which occurs the first couple of days of life. They take a heel prick and take a couple of drops of blood and put it on a card and send it to a special lab that will test for IRT in the blood. And IRT is immunoreactive trypsinogen, and that's a protein that is made by the pancreas that goes to the small intestine to digest foods. And if there's high levels of it, which is an indicator for cystic fibrosis, but it is also an indicator of um, stressful and premature delivery. So they're going to have to do more testing either way. So if there's high levels of it, which means that it's not that this IRT protein is not making it to the small intestine. So then the next test will be a sweat test, and that's basically occurs within a couple weeks or maybe a couple months into life for the baby, and they actually take some sweat from the baby and will test the amount of chloride that's in the sweat, and if there's less than 29 millimoles per liter, CF is unlikely. If it's in that middle range, CF is possible. They're going to do more tests to determine more clearly. Now, if there's over 60 millimoles per liter, CF is highly likely, but they're still going to do further testing just to be sure. You can do a genetic test, and if there's any positive tests here, they will do an they'll have to be evaluated at a CF Foundation accredited care center by a doctor that specializes in cystic fibrosis. Signs and symptoms: very salty tasting skin, persistent cough with phlegm, frequent lung infections like pneumonia and bronchitis, shortness of breath, poor growth, poor weight gain, difficulty in bowel movements, nasal polyps, chronic sinus infections, male and female infertility. About 97 to 98% of men that have cystic fibrosis are actually infertile, and that is because they do not have the congenital bilateral absence vas deferens, but they can still have biological children with the help of IVF. Complications with cystic fibrosis is that they cannot be around someone else with cystic fibrosis, and that is because that their lungs are very compromised, and if they get close to each other, or if they transfer germs or bacteria to each other, that can cause serious problems, increasing each other's symptoms, creating new symptoms, um, having new infections that are harder to treat. Since cystic fibrosis can be a very deadly disease, it could make it even worse. And um, this will increase a the decrease of lung function. And then also infections, more infections can occur with cystic fibrosis, like pneumonia and bronchitis, like we talked about earlier. Um, Basically, what happens is the mucus that's in their airways can actually trap germs and can cause new infections or more frequent infections that they've already seen before. Some bacteria that is present in the lungs with someone with cystic fibrosis is Pseudomonas aerug- aeruginosa. And then they can also have inflammation of the airways, which is um, their walls, other airways can be weakened and they can get scarred, which can cause them to inflame and can start to close up their airway, which can cause respiratory failure. Mucus can affect the pancreas because mucus can block the ducts in the pancreas, preventing digestive enzymes to reach the small intestine to digest the food, just like IRT is one of those. Um, but it as lo- along with the digestive enzymes not reaching the small intestines, it can also scar the pancreas, preventing it from releasing normal insulin production, like not enough insulin, which can cause diabetes, which can lead to type 1 or type 2. And they can get treated just like normal diabetes. It doesn't really matter. Another complication is respiratory failure, which can lead to death more cases than not. Um, and the average lifespan with someone with cystic fibrosis nowadays, with everything that's the new treatments and medications, is around 44 years old. And but it can be shorter, it can be longer. That's just like the average. Treatments are quarterly visits to a CF care center to talk with their doctors for a new plan, how they're doing. They can also do airway clearance, which is the picture in the bottom right, is a high frequency chest wall oscillation vest. It's basically a vest that has two tubes and it's connected to a machine, and it inflates and deflates about 20 times a second. It's basically a vibration. It vibrates their chest to try to break up the mucus in their airways so they can cough it up to try to breathe a little bit better. There's also oral, inhaled, nebulized medications. I'm going to talk about an oral medication called Trikafta. There's also nutrition therapies, fitness plans, and lung transplant. So lung transplant is basically they just take someone else's that have healthy lungs and give it to someone with cystic fibrosis. It's not a cure because it is a genetic disease, but it can add uh, a few years or more to someone if it is a successful transplant. And someone with a lung transplant will have to take immunosuppressive drugs to help their body accept those lungs and not reject them. So Trikafta is a combination of Alexa Caftor, Tezacaftor, and Ivacaftor. and it's basically a modulating therapy. So it's all three of those drugs, basically into one, and they basically tried to you would give this drug to someone with a F508del mutation, at least just one of them. That's all it takes, and, it can actually help the CFTR protein do its job the correct way and, minimize CF symptoms. It's not gonna completely get rid of them, but it can, help minimize and, reduce them. So, Alexicaftor and Tezacaftor actually kinda work the same. They basically bind to the CFTR protein itself and will actually help it fold the correct way and activate it to do its job and to go to bring the CFTR protein to the cell surface, and which will hopefully allow it to open and to let chloride ions leave the cell. So ivacaftor is actually once it gets to once CFTR protein get to the cell surface, the ivacaftor will actually help it the protein's channel actually to stay open and let chloride ions out, because sometimes the CFTR protein can actually get to the cell surface, but it won't open and let chloride ions out. So chloride ions will stay in, so will the water. And there are my references.